From Penn State Health, this is Ask Us Anything About Alcohol Use Disorder. I'm Scott Gilbert. Having a couple drinks here or there is widely regarded as normal. There are even studies that say a glass of wine each day could be good for you, right? Well, for about 16 million Americans, though, drinking is a vicious habit that carries a medical diagnosis. That diagnosis is alcohol use disorder, or AUD. Here to tell us more about it today, some of the warning signs and how it's treated, is Bill Milchak. He's an addiction counselor here at Penn State Health. Bill, thanks for being here today.
My pleasure. Thank you.
I want to start by asking where that line is between normal enjoyment of a drink and AUD. I mean, it's kind of a spectrum there, I know, but really, how do you kind of distinguish between that?
Sure. Actually, normal drinking, social drinking, responsible drinking is a little bit hard to define. A social drinker, a normal drinker, is best defined as someone who's not having problems. Once your drinking creates some problems for you, then you moved over into problem drinking. So normal drinkers should not be having alcohol-related problems, and then we can talk about what some of those problems might be. So normal drinking, what is social drinking? Is it 2 drinks 2 or 3 times a week? Is it 1 drink a night? Is it 3 or 4 on occasion?
What's the medical community's opinion on that?
Well, we like to talk about low-risk and high-risk drinking. So low-risk drinking for a male is no more than 4 drinks a day, standard drinks, and no more than 14 a week. For a female, we like to say no more than 3 drinks at a sitting and no more than 7 a week. So we say low risk because if you're drinking at that capacity, you're probably not going to have problems. You're not going to be at the legal limit for drunk driving. Sure. Probably not going to,
Why are those numbers different for men and women?
Women don't metabolize alcoholism as well as men. Yeah, and that's...
Well, we hear about the term alcohol use disorder. That may be new to some people, and the term that we might be more familiar with is alcoholism. So-and-so is an alcoholic, those types of labels. What's the difference there between the two? Okay.
For about 3 decades, diagnostically, we looked at alcohol abuse or alcohol dependence. And dependence, was the same as addiction or alcoholism. 5 years ago, we changed the diagnostics to putting alcohol on a continuum and now call it alcohol use disorder. So we did away with the abuse or dependence, and we look at it now on a continuum. So you have a mild alcohol use disorder, moderate, or severe. And severe would play out just as alcoholism would or alcohol dependence. We just call it something different.
Got it. You're watching Ask Us Anything About Alcohol Use Disorder from Penn State Health. We welcome your questions for Bill Milchak. He's an addiction counselor here at Penn State Health. So feel free to add those in the comment section below this Facebook post, whether you're watching this video live or after the fact, and we'll make sure we get you some answers. Alcoholism, as it's commonly referred to, is something that everyone seems to have a connection to. Possibly there's a connection in your family, and we welcome your questions today during this interview with Bill. So can someone not be a binge drinker and still have AUD? And I guess in order to answer that, we have to start with what is defined as a binge drinker.
So a binge outing for a male would be 5 or more standard drinks. Some people say that's across like several hours. Some people would say 5 or more in a day would constitute a binge. For a female, it's 4 or more drinks. So if somebody is binge drinking, if they binge once a week, once a month, twice a year, they would probably avoid a lot of alcohol-related problems that would put them on that spectrum. But frequency is important. If you're binging 2, 3, 4 times a week, you just kind of do the math. You could be, hurting yourself health-wise, run the risk of, DUIs and all those kinds of things.
Mm-hmm. Well, if you suspect a family member or friend has AUD, what's a good first step toward trying to raise the issue? I imagine it could be a difficult conversation to have.
Yes, it is, especially when they don't recognize there's a problem. And it's the sad thing about addiction is that everyone around the person that's addicted recognize it, but often they don't. So let's say it's a spouse, and you're concerned about your spouse's drinking. Probably the best advice would be don't approach the subject until you're both rested, relaxed, in a good frame of mind, not in the midst of a drinking episode or somebody coming in and they're intoxicated. And the other thing I think is really important is we don't want to look at it sympathetically, but more empathetically, you know. And then if you really suspect a problem, you know, there are interventions. You know, there are actually professionals who are certified in doing interventions. I use them quite often. Where you can contract with them and they'll just go out kind of like the TV model, you know, that we see. But people that do that.
Do you often find that some people may have AUD but not realize it?
Oh, absolutely. Yeah. You know, there's a lot of use of, you know, people minimize how much they're drinking, how often they rationalize. I don't drink as much as my friends, or, you know, I know someone that drinks more than I do, or I only drink beer, I don't drink hard stuff.
So they make up excuses in their mind to make it okay.
Absolutely. Or they project that if you had a wife like mine or a boss like mine or a husband like mine, you'd drink too.
Joke it away. Yeah.
But you know, you take it off yourself, because once you own it and accept it, then you got to do something about it, you know.
You're watching Ask Us Anything About Alcohol Use Disorder from Penn State Health. Your questions for Bill Milchak, an addiction counselor here, are certainly welcome. Just add them to the comment field below this Facebook post. About 16 million Americans are affected by alcohol use disorder, and as Bill was just saying, some of them don't even realize it. What are some of the risk factors? What makes somebody most prone to fall victim to this?
That's a great question, because, you know, there's a lot of unknowns in addictions. You know, we still can't fully get our arms around it. But with alcohol, this we know, that genetic loading is critical. So if I have a mother or father that has an alcohol problem, a dependence, you don't, I'm 4 or 5 times more likely, if I begin to drink, to move on to a dependence than you are. The second greatest risk factor would be starting to drink before the age of 15. You know, people that start to drink, kids before the age of 15, are about 50% more likely to develop an alcohol problem than their peers who don't.
Do we know why that is? Is it just because those are formative years?
Could be. I think, again, it's just, you know, something they've identified over the years, and, you know, is a key risk factor.
And when we talk about what ages are affected most, is there a gender or an age group that is affected most by AUD?
There are certainly some age groups that seem to be at a little more risk. Like you take the 18 to 35 group, you know, in transitions, you know, the service, high school, college. I'll give you an example of it. College students, if you look at their drinking, a lot of them would actually meet the criteria in college for like a moderate or severe problem. But the good news is that the vast majority of them, you know, finish school, get on with life, and set that aside. But we worry about that group. Now we're worrying a bit more about older adults. You know, actually, one of the premier rehabs in this area, Caron Foundation, has set up a boomer unit, because they found a lot of the 60s generation now retired and, you know, falling back on smoking marijuana and drinking again. And so you actually have a unit now for older adults.
It may differ by generation. In fact, I saw some really interesting numbers. Some 623,000 adolescents, that is those between the ages of 12 and 17, were identified as having AUD in 2015. Do you find those numbers alarming or not so much?
I don't know that I'm not real sure about that number, because I probably wouldn't see it a lot in 12 to 17-year-olds diagnostically. I don't know how many of them would actually have a disorder. Maybe on the mild side, but it's unusual to see somebody that would be having, you know, withdrawal and you know, tremors and seizures and things like that young, you know. So, but drinking problematically and moving towards a problem, absolutely. You know, I don't know how many of them would actually be diagnosed in that age range.
You're watching Ask Us Anything About Alcohol Use Disorder from Penn State Health. Feel free to share this post on your Facebook page if you're finding the information useful, as we do hope that you are. I'm wondering what some of the withdrawal symptoms are people may face if, let's say, they may realize they have an issue and then they try to step away from alcohol. In a way, it's going to be like trying to quit a drug, right?
Yeah. So it's important to note that, you know, somebody who is that normal, social, responsible drinker would not be having withdrawal. Withdrawal, for a lot of people, the first time they recognize it is when they start to have the morning shakes or tremors. We call it, you know, morning shakes. So maybe they haven't drank in 6, 8, 10, 12 hours, and in the morning they're having tremors. And often, the best recourse for that is to have a couple of drinks to take the edge off. With more impairment, people can have DTs, delirium tremens, where they actually see things, see the snakes, the lizards, the elephants. They can have seizures. So withdrawal, it's the only withdrawal, actually, when you think of drugs, that's probably lethal. You won't die from heroin withdrawal, cocaine withdrawal, even marijuana withdrawal, which they think there is a withdrawal. But alcohol, you can die.
Yeah, and when it comes to impact on the individual, we've talked about some of the effects it can have on a person's life. But what about those around them, their family and friends?
Yeah, years ago we started looking at alcoholism as a family disease. I mean, think of a family as a system. And when one member's, in trouble, everyone's impacted. So, you think about it, there's a lot written about adult children of alcoholics and children of alcoholics and the impact mom or dad's drinking has upon them. Suzanne Summers years ago wrote a book called Keeping Secrets, talking about what it was like to grow up in an alcoholic home. Very insightful. So it impacts the kids, and in many ways. And often we just don't pick up on it.
Another one of those statistics that I found interesting is that they say about less than 10% of people with AUD actually seek treatment for it. Why is that number so low?
Yeah, and I see 10, I see 20, and that's true also of other drug problems than just alcohol. Again, people got to recognize they have a problem. If they're not ready to change, why would they change? And
then there's dealing with the stigma too.
Yeah, absolutely. And the stigma is really important to keep in mind. We're seeing that played out with opioids right now, with heroin addicts, people that are addicted to pain pills. Stigma, we stigmatize based upon, do we think somebody caused their problem, and do we think they can control it? Okay, when you think about diabetes and hypertension, did they cause that? Can they control it? But when you think about somebody that's drinking, a lot of folks still think that, they caused a problem and they can control it. So that's kind of how we get stigma.
And so do you think that having this out there as a diagnosable disorder helps people to realize that this is something that needs medical attention, it needs intervention from professionals? It's not something that people can always deal with just on their own.
I think the AMA, it was 53 or 54, called it a disease. And I think a lot of people still, in the public, struggle with that. I mean, is it a bona fide disease as heart disease and diabetes? I think that's still a sticking point for a lot of people.
Well, and let's talk a bit about the treatment of AUD. Okay, if somebody comes forward or, they're able to get into treatment, what does that treatment typically entail, especially for those who may be at the end of the spectrum with more severe condition?
So we have levels of care, and they kind of go from intensity. So somebody has withdrawal where that's a concern. We have a hospital level of care. They'll have a hospital detox. Then we have residential treatment, like your standard 28-day model. They made a movie about 28 days. So you can end up in a hospital, or you can go to a 28-day freestanding rehab where you stay. And then we have partial, where somebody will go 5 days a week but stay at home and just go in 4, 5, 6 hours a day. Then we have intensive outpatient, where you go 3 times a week for 3 or 4 hours. And then we have standard outpatient, where you go 1 time a week. And then, of course, all the good 12-step programs like AA, and there's faith-based programs too, which are really quite helpful.
And so if people don't seek treatment, what are some of the possible long-term impacts of that?
Yeah, this is what I see in the hospital quite a bit. Is I get a lot of admissions with alcoholic pancreatitis. We see a lot of alcoholic liver disease. If you have diabetes, if you have hypertension, and you're abusing alcohol, it just complicates everything. It throws all your chemistry off. So you can actually get organicity. Have some cognitive deficits from drinking. So it just impacts, the whole of your body, and even your thought as well.
It's having an impact on different parts of your body that you may not realize at the time.
Absolutely, yes. And, pancreas and liver. I mean, sometimes it results in people needing transplants. And
You're watching Ask Us Anything about alcohol use disorder from Penn State Health. Bill Milchak is an addiction counselor here. He welcomes your questions. Just make sure you drop them in the comment field below this Facebook post. Whether you're watching this video live or if you're watching on playback, we can certainly get you some answers. You know, this is a time of year when people may be seeing members of their family who they haven't seen in a while, possibly even since last holiday season. So this is a good time, is it not, for people to be on the lookout for family members who may exhibit symptoms of AUD?
Sure. So, you know, in this country, you know, we come to equate having a good time often with drinking. And, you know, you can do that and not binge drink and, you know, not drink to intoxication. But just because someone does do that, maybe a college kid home visiting friends, and that happens a couple of times, does not mean it's a diagnosable disorder. But, you know, at the holidays, again, you know, we equate, you know, holidays, sports, a lot of things with drinking. And I know at the hospital we'll have a big rush of alcohol-related admissions right after the holidays and right after Super Bowl.
And that's no coincidence, I guess.
I don't think so.
If you can predict it. Yeah, I'll be darned. And so again, just to reiterate, if someone does feel that there's a bigger issue than just maybe a couple too many beers around a holiday, what are those first steps to take? What do you do to encounter that family member in a way to, and we talked about this a bit earlier, but you know, maybe give some folks some ideas or some tools to use to approach them?
Well, oftentimes, I'm a big fan of employee assistance programs. You know, employees at Penn State have one. Most employers, you know, medium, large size will, where you can just encourage somebody, hey, look, you got a free service at work. You go in, you can meet with somebody 2 or 3 times and kind of flesh this out, see where to go. Again, you know, family members, it's a challenge, you know, bringing that up. You know, you run some risk when you step out there and bring these issues up. But you know, if you do it when you're at a calm and things, and what you do is, you know, you talk about the good times. Do you remember when we used to do this and when we were able to do that? And do you remember your health, you know, before this kind of drinking? And just sort of ease into some dialogue.
Take them on that journey, tell them some stories, conjure up those memories.
Sure. Absolutely.
Well, Bill, this has been some great advice. Any parting words as we close down the interview here? Anything else we didn't touch on?
No, I don't think so. I think you covered it well.
Good deal. Well, Bill Milchak, thanks very much for your time. Bill is an addiction counselor here at Penn State Health. He's been our guest. Thank you very much for watching as well. Ask Us Anything about alcohol use disorder from Penn State Health.